Hi, my name is Karina Gonzalez, and welcome to my root cause analysis on hand hygiene. My practicum was done at the El Paso Children's Hospital, and I was shadowing in the quality department under Alice Fennell, the Administrative Director of Quality. Alice oversees two directors. They each have their own teams as it pertains to the quality department. My project topic was a root cause analysis that was used to initiate and prioritize hand hygiene. It focuses on systems and not individuals. It emphasizes errors often as a result of systemic weaknesses and not just mistakes. It aims to identify how the system failed rather than solely blaming individuals involved. It reduces the risks of healthcare associated infections, identifying the potential risk and barriers determined the best practices for the national patient safety goals, implement targeted interventions to improve compliance, and align with the Joint Commission expectations for infection prevention. So the best way to think of it was what happened, why did it happen, and what can be done to prevent it from happening again. The National Patient Safety Goal. Comply with either the current Centers for Disease Control and Prevention hand hygiene guidelines and or the current World Health Organization hand hygiene guidelines. This is what the National Patient Safety Goal, which is now known as the National Performance Goals, that was based off of what the Joint Commission was requesting from a hospital perspective. The project goals was to align with that of the Joint Commission, so the CDC and the WHO standards, whether that was to a strong recommendation supported by well-designed experimental clinical or epidemiological studies, a strong recommendation supported by some experimental clinical or epidemiological studies, and a strong theoretical rationale, or required for implementation as mandated by the federal or the state regulation or standard. The Joint Commission does not determine the goals or scope, but they should be based on the organization's risk assessments, organizational priorities, and the resources. The CDC states facts of patients getting infections in healthcare settings, therefore, hands can spread germs. The WHO guidelines provide a review of evidence on hand hygiene in healthcare and specific recommendations to improve practices and reduce transmission of pathogenic microorganisms in a healthcare setting. Current guidelines are intended to be implemented in any situation to either a patient or a specific group in the population. Welcome to SwipeSense, an automated hand hygiene monitoring system. Here's how it works. There's a hygiene sensor, an entry sensor that reaches to the caregiver badge reel, the location that reads to the communication hub, and then reports to the dashboard, along with the NASA tag in the area. Real barriers are thought of as already present barriers observed or reported. For instance, staff resistance is a real barrier because of the preference of direct observation, which can create false readings due to human error. For instance, one friend can be observing another friend coworker, and that means that they are scoring the highest. Or it could be the opposite, where someone who doesn't like another person scores them low due to very specific expectations. So there is not a consistent version of expectations. Limited awareness of compliance expectations also affects compliance, as well as inconsistent staff interfering without intervention. A workflow disruption is a real barrier when there is a high patient to nurse ratio and not prioritizing hand washing. Interference of device alarms during workflow also causes disruption in compliance. The technical and equipment issues arise with hardware malfunctions of software, sensors, or the Wi-Fi. To implement a root cause analysis using the plan, do, study, act cycle, determine the improvement of staff education on hand hygiene and device usage, reinforce leadership accountability and role modeling, and the swipe send feedback data through dashboards and reports. In the plan phase, it was to identify low compliance trends. The do phase implements interventions such as targeted education, leadership modeling, and swipe sense reminders. The study phase was review monthly compliance reports and gather staff feedback. And the act phase was to roll out the swipe sense and its education. Scaling up successful strategies, refine interventions where compliance lags, and repeat the cycle for continuous improvement was one of the better ways that this was able to follow through. An RCA frequently used to investigate adverse events, which are unexpected occurrences that result in harm to a patient, not limited to include errors, near misses, or other incidents that could lead to patient harm. An RCA follows a structured process, often involving a multidisciplinary team to collect data, analyze the sequence of events, and identify contributing factors. This is how the quality department really was able to put their hands in on what this project was going to be, implementing the swipe sense system, and they were able to use their teams to assure that the equipment was well, the measuring of the metrics was well, gathering with the supervisors and the managers of each team to ensure the compliance rules, and that way they can roll out the staff education and so on. So what was the project outcome? SwipeSense technology added to the hand washing stations to reduce hospital-acquired infections. Badge reels were given to staff. That way they can enter each room and it be monitored. Dashboards provide data for compliance. As each badge reel is detected when a staff walks in, the dashboards are picking up the data. Increase compliance with hand hygiene protocols, and this meets the guidelines of the CDC and WHO standards. Reduction in risk of hospital-acquired infections. Washing hands is one of the most simple ways to reduce the hospital-acquired infections, and this keeps accountable to each person. Improve staff confidence in technology use. Sometimes it is very uncomfortable for staff whenever introducing new type of features and new technology, but with the introduction of it and the continuous practice, it became more comfortable there was more confidence in staff to use it. The strengthened accountability culture, which assures that there is a percentage per person based on their badge reel entries on how their compliance to hand washing goes. The stakeholders. Leadership was very supportive due to the safety and compliance focus and supportiveness due to the alignment with safety goals. The frontline staff was cautious at first, but receptive after proper education and feedback loops. And the infection prevention team endorsed it. They strongly endorsed the implementation to increase the compliance of hand hygiene as it aligns with CDC and the WHO hand washing guidelines. How was the project sustained? It was sustained through monthly compliance reports, ongoing staff training, and leadership oversight. If resource allocation shifts, the PDSA approach ensures that the staff can continue small tests of change and refine the practices without heavy reliance on one-time training. That includes annual trainings to make sure that they all are aware of the compliance for hand washing. Continuous quality improvement is an integral part of this RCA as part of continuous quality improvement efforts in healthcare, helping organizations learn from their mistakes, and improve their processes over time. Here's an example of a dashboard. We want to show the difference between 1 year to the next year and their compliance rates, just to assure that there is a constant tracking. Now, the next steps of a project handoff. The quality department is to maintain compliance with hand hygiene and ways of overseeing the department's compliance. Corrective actions address root causes leading to sustainable improvements in patient safety and preventing future errors. Explore the integration of compliance metrics into staff performance reviews and annual competencies. And continue an interactive PDSA cycles for continuous refinement. The professional goals and leadership skills that I gained from this project, I got to strengthen my professional skills of interprofessional teams. There were various teams that went into getting this project going that led anywhere from the nurses to the emergency room directors, to the emergency department directors, to the quality department, to the facilities organizations, including in this case, the facility that they quote unquote rent their building from, to assure that they are following all the Joint Commission and other regulatory agency guidelines. The driving of quality improvement, that was the understanding of what the quality team was to do to ensure that compliance was always being met. Applying the RCA methods in practice, that was showing how the PDSA cycles were also involved in determining the root cause for needing something like an intervention like this, such as swipe sense. My leadership skills, I got to see conflict resolution. There was conflict between several departments. There was one in particular who was sending new staff to every meeting rather than having a consistent person attending these meetings. Therefore, they were falling behind each time, trying to catch up the person who was joining their meeting versus having that person just jump in and knowing where the last person left off and continue moving forward. I strengthened my engaging stakeholders. So you want to assure that the frontline staff, as one of the stakeholders, is very involved in the training and the hands-on, and as well as the implementation. Accountability reinforcement. Once the data has started, it is important to follow up and show, maybe even through a grace period, what the previous numbers were and what the goal is for the year and what the consequences could be if those goals are not met. So using data for change management, being able to show evidence-based to the teams allowed for the change to move forward. Data-driven decision-making was also able to determine the way to move forward in parts of the project. So what did I learn from this project? Leading change requires both persistence and flexibility. PDSA provides a flexible and ongoing framework. Continuous cycles of improvement are more effective than one-time interventions. Collaboration across roles is crucial. Technology alone cannot fix compliance. Leadership and consistent reinforcement are critical for cultural change. Thank you very much for joining my project. And I hope that many other different areas get to see and introduce SwipeSense into their facilities and show the progress that it can make. Thank you.